Senator Weiner says he has been working for several years to pass a bill to make harm reduction legal, but it was vetoed by Governor Gavin Newsom. You were close, and then
very close.
And then the governor vetoed it this time, but you're not giving up.
No, because this is about saving lives. And I think we need to be really clear. When we talk about the word enabling, what harm reduction does, the only thing it enables is for people not to die. These are people, when we look at the people who are participating in harm reduction, if they're going to a safe consumption site, if they're going to a needle exchange, these are people who are already right now using drugs. We don't have safe consumption sites in California. We don't have them. And they are already using now. They're injecting, they're doing whatever they're doing. These are people who are addicted. Some of them have lost their homes, their jobs, their loved ones, and they are still using. We're not enabling them. They are using. We want them first not to die, and then we want to connect them to treatment.
The senator just said that there is no supervised drug consumption site open in California. I was the first journalist to break the story of an illegal supervised drug consumption site in United Nations Plaza. I can't believe that you say that it doesn't exist. The drug dealers are right across the street selling fentanyl and meth, and the addicts would not just stay inside the supervised drug consumption site. It has taken over the entire plaza. This is the United Nations Plaza where there was a farmer's market. The people have been driven out of this area. It's a place of violence and crime. You know, we have 3 times more deaths of homeless people in Los Angeles than there are deaths of homeless in New York. And the reason is because in New York, people are required to be in shelters. That's fundamental. They're not allowed to engage in open-air drug use in the ways that they are in California. So it's pretty outrageous to suggest that that site is not being operated currently.
And you've said some really outrageous and inaccurate things today too, Michael. And you're not even arguing that LA has any kind of safe consumption sites, and people are still dying. And so we have people who are using right now. They're dying right now. I don't want them to be using meth or heroin or fentanyl, but they are using it because they are addicted. And the question is, the only question with safe consumption sites is, do we want them to stay alive? Do we want them to overdose behind a dumpster where no one's there and they die, someone's child dies? Or do we want them to be in a location where someone can then administer an overdose reversal and they don't die? That is the question.
If the supervised drug site in San Francisco is working so well, why did the governor veto it?
The governor can veto whatever bill he wants, and he does some good vetoes and he does some really bad ones. This was a pilot program. All this bill was a pilot program for 5 years because it's been used in other countries successfully. And the governor said, I don't even want to let you try it out. I support the governor. He was dead wrong on this one.
I've been in this arena for 45 years, and my position has been, you never surrender to the disease. You never surrender to the disease. You never say...
Letting people die on the streets is surrendering to the disease. We are just allowing these people to be treated like human garbage and die on the streets. We are trying to help them and save their lives and get them into recovery, because that's what these sites are about. It's about saving
around the
them.
world. So we know from around the world, Amsterdam, Frankfurt, Lisbon, Vienna, Zurich, and people can look it up, open drug scenes, study of 5 European cities. They shut down the open-air drug scenes. They shut down the open-air drug markets. They require people to sleep indoors. They do not normalize or enable open-air drug use.
No,
yes,
they
it's
have
true.
safe injection sites.
There is a small number of supervised drug sites for the really hardcore addicts who could not quit. And those people are encouraged to get into recovery.
Right,
the goal is recovery. What they have done in San Francisco, and which the senator appears to be denying exists, is they've turned over a large part of downtown to an open-air drug market which exists around the supervised drug consumption site, which is operating illegally in United Nations Plaza and is going to be shut down by the mayor because it's been such a total catastrophic failure.
Can I say
that's
something?
Why it's
yes, that's a disaster there, but that does not represent what Europe does, and he's misrepresenting it.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.